Welcome and good afternoon. My name is Melanie Mitros. I am the Director of Strategic Community Partnerships here at Vitalis Health Foundation. And this is my colleague, Emily Kepner. Emily is our Program Associate here at Vitalis. She is the magic behind the curtain that keeps all of the rest of us on track. So when things go really well, you know Emily is somewhere behind it. Things don't go well, somehow or another we left her out of the loop. So she's a great person to know if you can't get a hold of one of us. She's also a really great person to reach out to if you need to get on a calendar or if you need to get connected with one of us and for some reason it's not quite working out directly with us. So for those that just came in, I do have business cards and there's flyers there at the end of the table. There's a sign-in sheet coming around. Please make sure to sign in, write as legibly as you can for those email addresses. We are recording today's presentation as well as we've recorded the ones yesterday. We'll be uploading whichever one has the best audio quality tomorrow morning. The PowerPoint presentation will be uploaded tomorrow morning as well with that recording. We've had a couple of questions that are not directly addressed in the presentation. We'll probably upload those as like a Word document, FAQ. So I think there's maybe 3 or 4 of those questions that have come up that are not directly addressed in the presentation. So we'll make sure that those get addressed. If you need to use the restroom, back out the front doors, past the elevators, hang a right and come all the way down the hallway on the right is where the restrooms are. And we'll go ahead and get started. So I think most everybody in here is relatively familiar with Vitalis. And so really what we're working to do is we are working to address the root causes that are affecting health and communities. So we've made a transition away from being what we were 21 years ago as St. Luke's Health System. When the health system was sold, those proceeds were invested into our endowment. Our endowment then kind of made us a trust fund baby. It's the best way to describe how we function is those proceeds then fund the work that we do in the community and with our grant making. We have 4 priority areas that we work in. So these are not our goals or our mission. These are the areas of work that we do. Access to care and coverage, health insurance coverage. In that area, that's Marcus Johnson. He oversees a lot of work also with workforce development. That's another piece of what he works on. And then the second area is working with municipal and tribal leaders on healthy community policies. So this is more at the municipal level. That's my colleague, CJ Hager. She also does a good bit of work around food access, the built environment, working with City of Phoenix on transportation, as well as now we've branched out and working on multimodal transportation, working with Living Streets Alliance down in South Tucson and Tucson. The third area of work is improving the effectiveness of communities and organizations, and this really digs even a little deeper into developing leaders, organizations, coalitions, and alliances. That's my colleague Raquel Gutierrez. This time of day, I'm having a challenge talking. I promise I've already had a cup of coffee, so I should be good. So Raquel Gutierrez, she oversees all of our capacity building work. If you've heard about our CAN forums or what used to be called TAP Talks, now CAN forums. Also a lot of work with civic engagement, civic participation, social justice work. That's the areas that she works in. And then myself, Melanie Mitros, I oversee our 4th area of work, which is promoting innovation and collaboration. Often we see these collaborations really are where they start in the community. That's what bubbles up and ends up being our innovation grants ideally, is that we're able to build relationships and then connect those into our work that way. I also do a good bit of work with our fire departments throughout the state, as well as working with several of our disease-focused coalitions and with community health workers here in Arizona. All right, so we'll walk through just a bit. You have a couple of chairs. I'm actually going to slide one right there. Absolutely. So this is just going to kind of give you a little bit of an outline of what we're going to walk through. We're going to talk about what we mean by systems change, what we mean by equity, what we're talking about when we say elements of a healthy community, a little bit different languaging, what the next steps are, and then actually go through some of the logistics of the letter of intent. I'm happy to answer questions as we're going, or if you jot them down, we can answer questions toward the end. I'll definitely take a break between talking about systems change and equity before we get into more of the logistical pieces. All right, so great quote kind of defining what we mean by innovation, that the backbone of innovation is collaboration. We really want to make sure that folks understand the distinction between coordination and collaboration. Coordination is kind of viewed as you have everybody in their cars, all going to the same destination, all on the same highway. Collaboration is where everybody's in the same bus. Everybody's in the same car going to that same destination. We really are looking for those projects that are at that collaboration stage. Coordination definitely works a lot of times, but we really need to see this deep collaboration to see systems change happen. So with the innovation grants, this is kind of our thought process or our theory of change of what we're looking for. We're looking for the sweet spot of testing and implementing solutions. So you've already worked through these other 3 stages with your partners. So you guys have already identified there's an opportunity to transform. You've created collective understanding. Everybody's on the same page about the issue and about this opportunity. The ideas have been generated and you're ready to jump in. You're ready to get going with implementing these ideas. So kind of take a hat off when you think about innovation. Most people think about like technology innovation, something that's completely brand new that nobody's ever heard of. The definition of innovation of what we're talking about is innovation is a breakthrough addressing a community issue that's more effective, more equitable, and more sustainable than what already exists. It may not be brand spanking new, squeaky new, but it's a new approach or a different approach to solve a community issue. So a couple more ways of thinking about community innovation. It meaningfully engages stakeholders, willingly shares ownership and decision-making. So shared decision-making that's not willing is not what we're looking for. There often is shared decision-making and it's not necessarily everybody really actively participating. Creatively uses existing community resources and also collectively practices testing and implementing so that the plan, do, study, act, and you're always in that iterative cycle of thinking through how do we make this better and better. Okay, so systems change. By definition, systems change is one that is fully sustainable and not connected to grant funds or external expectations, but rather an organizational or cross-system priority to new policies, cultures, communication, or practices. That's the sweet spot of what we're looking for. We're looking for systems change. One of the I think the easiest ways to kind of make a distinction between a program and a systems change project is the sustainability question. If you are 100% successful in what you're proposing, a systems change should not require additional grant funding to go forward. There may need to be state funds allocated to implement whatever change has been made. There may be funds like that that are needed, but it's not something that's going to need additional grant funding to continue going forward. So I'll give you a couple of examples of projects that we have going right now. Always, the Arizona Legal Women and Youth Services Project. They've got a group of partners, about 5 to 6 organizations that are working together. They are working together to close youth records when they turn 18. Right now, Arizona stands as one of 7 states that does not close youth records. So if you think about that, like what kind of implications could that have? You have a youth who made a bad decision when they were 14, 15 years old. Well, that bad decision now is going to have lifelong implications, even though they're on a good path now. So keep that example in mind, and we'll come back to that example talking about elements of a healthy community. But if they're 100% successful, that legislation and policy changes. Yes, it's going to take money to go back and close records and maybe change the way procedures and practices go forward, but that piece of it is done. All right, don't panic. These are questions for you to go back and reflect with your group. I am not going to read through all of them. You will have them tomorrow morning posted on the website. You will all get an email notice of when they're posted, promise. Okay, these are just really great questions to sit down with your group of partners and say, are we really talking about systems change? Work through these questions and they will definitely help you get to that point of saying, yes, we are. We're talking about systems change. And guess what? We have a good, clear identification of who's in power and who has the authority to help us make these changes. We have them at the table. Maybe we don't quite have them at the table yet, but we know who we need to get to the table. Okay, so this slide and this next slide, so this is systems change process. These are good questions to work through. They're not questions that you need to answer and submit in your letter of intent, but they're just good questions to work through with your partners and so that we have a little bit deeper peek into what we're looking for. One other thing is the last question on here I will point out, is there a clear understanding of the human dynamics that are affecting the need for this systems change? That's an important point because often we think about, oh, we need to change the justice system because youth records are they're not being closed. We need to think about who are the actual people who could affect that change. What are the human dynamics across those people? Do you have the right leadership in place that they can make that change, or do you have the right people influencing that leadership to get them to make that change? So keep those human dynamics in mind. All right, so that's systems change. Any big questions come up on systems change? Anything online? Nope. Okay, so the next one, equality versus equity. I'm sure folks have heard this discussion. They've seen the different graphics that are out there. Have a friend that actually presented this at a Diabetes Coalition meeting last week. I was like, oh, I like that image a lot better than what we had been using, much more applicable to our work around multimodal transportation, as well as addressing inequities. It really is a great graphic from Robert Wood Johnson Foundation and their Culture of Health work on showing just exactly having the same exact thing for everybody doesn't work. But if you're looking at can we get the right fit for the right need, it makes a big difference. So equity is not something that is done to, it is something that we work towards. Equity is the work, it's what we're doing, and it's how we do that work. Those are two very critical distinctions. We can't say, we are going to do equity. It's like, no, we are going to practice equity. We are going to use a health equity lens in the work that we're doing. So really keeping it focused on the way the work is approached. Oh, too far, sorry. So again, these are reflection points to work through with your partners. Thinking about health equity and ensuring that the approach you're taking to the systems change you're proposing is keeping equity in mind, and we're always working through that lens of engaging the individuals who are going to be the ones receiving the end product or most impacted by the end product. They need to be alongside you every step of the way throughout the whole process, not just once you've already come up with what your idea is. They need to be involved in that entire process. I'll use another example with this one. So the Chandler Fire Health and Medical Department just received a grant to develop crisis support training for paramedics in our fire system. There is not a crisis support training that exists for paramedics. There's one for police, the crisis intervention training. It's a 40-hour training that really is very focused on de-escalation and then the use of force, either through tasers or guns. It's just a different dynamic than when a police officer comes in versus when a paramedic comes in from a fire department in particular. So there's not a training that's designed there. They have 4 hours of behavioral health training in paramedic school. In our day and time, that's insufficient. And so they've really identified this as a critical need for paramedics across the country. They're gonna take it on, But the way they identified that it was a critical need was going back and talking with behavioral health patients that they had gone on calls with, and the paramedics who had gone on those calls. Some of them very successful, some of them not successful at all. And so really getting that feedback from the patients and from the paramedics, and then they came up with the idea that this is what we need. We need more training to be able to better serve our community. So that's a great example of the equity lens being used from day one. Well, again, questions to ask as you sit down with your partners, questions to reflect on. Okay, so that's kind of the focus of equity. Any initial questions on the equity piece? 3:30 in the afternoon is rough, I know. All right, so your typical vision of social determinants of health, right? We know that health is made up of much more than health care. Well, of course, you know, being the folks that we are, we wanted to take it a step further and say, how do we look at the intersectionality? Not just that these other social determinants exist, but how can we make the connection of, remember the always example? Primarily focus on social justice. But then what are the implications if they don't do this and those youth records stay open? For those youth, guess what? Getting a job is going to be really hard. Getting a place to live is going to be hard. Getting a better education is going to be very difficult. Well, then if those three are impacted, how many more of these elements are then impacted if they don't have that support? So we want you to make sure in those letters of intent that you're able to really focus. This is the element that our project is focused on. These are the other elements that have implications if we don't do this work or if we do. You pick on how you want to frame it. There are not bonus points for saying you're working in all of them. I know that's tempting, and I know many of these projects will affect way more than one. But be focused, be very, very focused on where your primary area is, and then what are those very next step layer. This is also already on our website. So there's a link on our website where you can download. It's actually a 4-page packet that has a little description and a little bit more details about each one of the elements. All right, so just kind of to recap, the ideal innovations we're looking for, they need to result in a cultural, a regulation, a rulemaking, or a policy change. We really are looking for those types of systems changes. The project needs to address root causes and barriers to healthy communities. There needs to be a clear alignment and understanding of how it connects to the elements of a healthy community, as well as the intersectionality of that next layer. And then, of course, using a health equity lens to approach the work. Okay, I'm going to take a break. That's kind of the background info before I get into logistics. I see forehead scrunching around the room. Are there questions that are percolating, or are you just processing? Processing? Okay. If questions come up, feel free to email me. Make sure you get a card if you don't already have my email, and just let me know. All right, so we're gonna walk through more the logistics side. Next steps, please take the time to schedule a meeting and talk with one of our staff members. The majority of the conversations will be with me, so you're more than welcome to just email me directly, but please, when you email me, send me 2 to 3 dates and times that work for your team. You do not have to have the whole team come and talk. It can be 1 or 2, it can be 1, however works for your team. But please send me 2 to 3 dates and times. It's 30-minute conversation, so it needs to be very focused. So you need to be coming in with that finely tuned idea that you already have kind of worked through these questions and thoughts. And don't feel like you have to wait to get on the calendar. So please, email me sooner rather than later. I will be out of the office this Friday, and our offices are closed on Monday. So, but then I'll be right back in the office on Tuesday morning to get those scheduled. What am I missing on that? Oh, thank you. Please make sure these are all scheduled before September 22nd. If we are having this conversation that last week of September, it's probably too late. I would highly, highly recommend that whatever feedback you get, that's thoughtfully considered and probably included. I mean, it really is the input we're giving is coming directly from what we know is in the review process. So if we're saying, hey, you might ought to think about this or that, it's very important that those are thought about. All right, so the big pieces to cover in your letter of intent. What are you gonna do? How are you gonna do it? Who are you doing it with? So get as specific as you can in those 2 pages. What are you gonna do? How are you gonna do it? Who are you doing it with? You do need a brief outline of the budget. And you don't need a matrix, you don't need a spreadsheet or anything like that. 2 to 3 sentences, brief outline. We're requesting $125,000 for over 2 years. The funds will be used for ... You don't have to give the breakdown of what those funds will be used for. Just give us a general idea of what those funds would be used for. These are the questions that we will be using to score the letters of intent. So this is what your letter of intent should be built off of, built from. You can put it in the order that it makes the most sense for your project. There's no scoring on the order of it. Does it follow this perfectly? No. It's about making sure you're addressing these questions. Okay, a little bit more kind of in the nuts and bolts of what budgets can be used for. So the dollars can be used for personnel, consultants, travel, food, convenings, project directly related to the project, indirect expenses, administrative expenses, operating expenses, but they need to be directly related to the project for those pieces. So the funds cannot be used for a for-profit company to be the recipient of the funds. So only 501c3 organizations, fiscal sponsor organizations that are 501c3, government entities, faith-based organizations. We did get clarification. We cannot accept applications or letters of intent from 501c6s. So, and we did also get additional clarification on universities and government entities have multiple departments and lots of people. We do only accept 1 letter of intent per organization. However, for for universities and for government entities, so like the Department of Public Health could submit a letter of intent, and then Maricopa County Sheriff's Office could submit a letter of intent, reviewing those as separate organizations. Within the university systems, it's kind of the same thing. You've got everything from engineering to social work. You've got a big range, so those different departments can submit a letter of intent. I will say you can be on more than 1 letter of intent or more than 1 project, just only one time for the lead organization. All right, and so no for lobbying. Advocacy, yes. Lobbying, no. We can't fund lobbying directly. And then no for capital expenditures. And capital expenditures is actual buildings and large equipment purchases. We have had like spaces of opportunity with Cultivate South Phoenix. They did use some of the funds for maintenance of their tractor because the tractor was so critical to the project work. That's fine because it's not purchasing or upgrading new equipment. It's just maintaining the equipment that's in existence. Any questions about what funds can be used for or can't be used for? All right, couple of tips. As I said, avoid the details of the full proposal, but use this as your launching point. Be as specific, direct as you can at this stage. Use the feedback from Vitalyst staff, or if you're already working with somebody on the staff, please continue to work with them. You don't need to necessarily have another meeting with me unless you just want to around process. Follow the guidelines that are already outlined on the website. Those are also included here. Only one LOI per organization. They are due on September 29th by 5 p.m. They will be uploaded to the website, so it'll be an electronic form that you can submit it either by Word document or you can convert it to a PDF document if you want to. Either one is fine. If you are having any issues with uploading it, do not hesitate to email us. And don't send me an email at 5:15 on Friday afternoon going, I was having issues and I couldn't get this to go through. Okay, we are closing it at 5. But if I know you're having issues before 5 and you're able to send it as an attachment in the email, that's fine. Okay, but make sure that communication is coming through before then. Don't wait till the last minute. The invitations to submit full proposals will go out by December 1st, so right after Thanksgiving holiday. And this timeline is also outlined directly on the website. The submission form is actually already on the website. I believe it's on the timeline page, isn't it? It's on the timeline page. It'll be highlighted even more once this is all done for folks to be able to find it really easily. But if you want to take a look at it already, you can take a look at it now. That's fine. All right, so if you are awarded an innovation grant, the relationship doesn't end there. We do not view this as a grantee funder relationship. This is a funded partner relationship. Yes, we're providing funding, but this is a deeply vested partnership. What we want to do during the course of that grant is during that 2-year time frame, we work with you through our learning sessions. So we have quarterly learning sessions. They're on a Friday. They're for 2 hours. We do lunch. It's all of the innovation grant recipients that participate in those meetings. We've had it be as full as this room. We've had sometimes it's like 10 of us, that it's kind of ebbs and flows depending on who's around and who's got what going on. But it is a great opportunity for not only the organizations and the projects to be strengthened, but for those individual leaders to be strengthened. We encourage participation of 2 or more from each project during the course of those learning sessions. Some of the topics we've talked about are listed up here. Some of the most powerful ones I think we've done are on power and privilege, systems evaluation, and planning for systems evaluation. Oftentimes you get into these types of projects, it's hard to evaluate them, for sure. All right, so questions?
All right, we had one question come in online. Just to confirm, do we need to be a nonprofit organization to apply for the grant?
Yes, you have to be an Arizona-based nonprofit organization eligible to receive charitable donations. Government entities and faith-based organizations do fit that qualification. The lead organization has to be one of those. You can have a partner organization participating that is a for-profit entity. That does happen, and that's fine. Okay, so that's the only one that's come in online. Anything else in the room? Yes.
If you have a program that you have already been working on, either it's in its early stages or it's been going for a few years, but what you're looking at is taking what you've learned and making a change that's going to have an effect on systems where there's another level you're taking to or something new you're doing, even though you've been doing something in the related area. Is that?
So we probably have to sit down and talk through it specifically. So if it's a continuation of an existing program, no, those funds cannot be used for the continuation of an existing program. If it's taken the lessons learned from an existing program to affect a systems change, then yes. But the funding is for that systems change piece, policy, regulation, procedural, or cultural change. And it does get a little sticky with that, but I challenge you to go back to that definition and those questions around systems change. Say, if we're 100% successful in what we're wanting to accomplish, will this still require grant funding? And if the answer is yes, then it's probably more programmatic than a systems change. Any other questions? Oh, you guys are quiet. Okay.
All right, so we have another question online. Can we use the funds to give stipends to residents?
Yes, funds can be used for stipends for either residents, consultants, whoever you are working with, as long as it is working towards a systems change.
Another question. What if the community group has a fiscal sponsor? Do we still need to get a 501c3 partner, or can we use the fiscal sponsor?
So a fiscal sponsor organization, if you're going to use a fiscal sponsor, that fiscal sponsor has to be a 501c3. So because the fiscal sponsor is actually the applicant organization, and then all of the other partners would be doing the work together. Is it online? I was only saying you had to be quiet if you went out there, not in here. All right, so seriously, no other questions right now. All right, it's either crystal clear or it's as clear as mud.
I do have one question. So at the very beginning of the presentation, you explained your colleagues, their specific area. Are all of their grant areas in this particular grant, or do they have their own respectives?
So we only have 2 grant cycles, 2 funding mechanism here at Vitalist. I oversee all of those. So I oversee the innovation grants, which is what we're talking about right now, which is our largest kind of publicly facing piece of grant making that we do. The other one that we have is our medical assistance program. Our medical assistance program is they are historic donor advised accounts that carried over from when we were the hospital. They still operate exactly how those, well, as close to as we can what they were originally intended to. So with those, these are all direct service. So very, very different than these innovation grants talking about systems change. The medical assistance programs are vision services, hearing services, substance treatment services, and community-based heart and lung interventions. So those are separate. We actually will be in January, we'll be doing a request for proposals for the vision and the heart and lung community services. And so those will be posted on the website. We don't typically do an information session like this because they are direct services. It's either screening or some type of assistive device that's being provided or an intervention that's being provided for those. So those are just the areas that my colleagues kind of focus their work on, but all of the grant making is in those 2 buckets. So it's more content. Like if you have questions about the built environment and multimodal transportation, I am not the person to talk to. If it's content specific, you need to talk to CJ, and I will say, please talk to CJ. I have no clue what you're talking about. She'll start talking about all different kinds of building codes and permits and codes for how you stripe roads and all that kind. I'm like, don't know.
I've got another question coming online. Could TAP-AZ be used for 501c3 needing to build their capacity?
Yes. So if you're not familiar with TAP-AZ, TAP-AZ is it's our sister organization, the Technical Assistance Partnership of Arizona. Their sole purpose is to function as a fiscal sponsor organization. They have multiple layers of fiscal sponsorships. They have grant-specific fiscal sponsorship. So if you're an organization that already exists as a coalition or a 501c3 and just need this to apply for one grant, you can partner with them to apply for that one grant. I will say if you are not already using a fiscal sponsor and you're looking to use TAP-AZ, it does take about 8 weeks to complete the process. That does not mean you can't still apply and say, we're in process of working with TAP-AZ as a fiscal sponsor. That's fine.
Another question, is there a range of funding that we can request in the proposal?
Yes, there is a range of funding. The range of funding as it's outlined here on the flyer, it's from $75,000 to $125,000. That is the total amount spread over that 2 years. Okay, so it's not per year.
How many on average do you award?
So last year we received 87 letters of intent. We asked 12 of those to submit full proposals and we funded 5. So this year we have funding again to fund between 3 to 5 of the projects. We have approximately $500,000 set aside for this year. The last 3 years, Arizona Community Foundation has also come on board and partner funded with us. So 2 years prior, we had $100,000 each year. This last year, ACF also brought $100,000. We also had Mercy Maricopa Integrated Care came on board this year, the Regional Behavioral Health Authority, as well as the Community Foundation for Southern Arizona. There is no guarantee that those will all be there again this year, but know that I will be taking these proposals and projects and offering them up to any and all of the funders that might have an interest. I try really hard to focus, if you're sending something specific to education in Southeastern Arizona, working with Hispanic Latino youth, I am going to immediately reach out to Helios and say, hey, can we partner on this, or is this something you want to fund? So we do have projects that we actually step away from and they pick up and fund that we don't. That's a good question. Anything else come in online? No. The one other thing is that it has to be Arizona-based nonprofit and it has to be Arizona-based work. So there may be implications and benefits beyond Arizona. One of our current projects, Feeding Matters, they're working on getting a billing code opened up for pediatric feeding disorder, because right now the first billing code diagnosis code that's open is failure to thrive. And if you're talking about in the 0 to 5 range, if you're hitting failure to thrive, you've had significant implications on brain development. So they actually are working on getting a diagnosis code for before failure to thrive for pediatric feeding disorder. Yes, they're doing that initial work here. They're working with an international committee, and it's definitely going to have international and national implications, but they are focusing that work here in Arizona. So it can have national implications, but has to be focused here. I just saw that other one. Thought I'd address it in that way. All right. Anything else? Yeah. All right. So don't hesitate to send me an email. I will say trying to call me on the phone is next to impossible. Send an email with a couple of dates and times. I'll turn around and send you a calendar invite so you'll already have it on your calendar for when we can talk. Those meetings do need to either be here at Vitalist, or we can do them by phone or by video conference to make sure we can pull in as many of your partners as we need to. Otherwise I don't have the time and the day to be able to travel to different places at this point. All right, is John recording yet? Okay.